As we have seen the novel coronavirus evolve into a global pandemic which has impacted almost 200 countries across the globe. During that time, the world has recorded 283 million cases of COVID-19 and over 5.4 million deaths because of COVID. In the past year, new vaccines have been launched to offer protection against the virus, and to date, almost 9 billion vaccine doses have been administered globally. The virus has been very resilient, and we have so far experienced 3 waves of infection in our country. Regrettably, however, the coronavirus pandemic seems to be far from over. In recent weeks, a 4th wave has emerged as there has been sharp surges of COVID-19 infections throughout Europe, the United Kingdom, North America, due to the Omicron variant. In the past weeks, we have also seen strong surges in cases here at home, which would indicate that this new variant has hit our shores. We have sent samples abroad for testing to determine conclusively if this is the case, but given the epidemiological trends, we believe that these tests will confirm the presence of the Omicron variant in country. Over the past week, we have seen our daily cases climb from 26 on December the 20th to 159 cases in December the 27th, with 149 cases in New Providence, 5 in Grand Bahama, 2 in Exuma, and 1 in Abaco. This clearly shows that the epicenter of this virus is in New Providence. Since the start of the pandemic, a total of 24,269 persons in the Bahamas have been infected with the virus. As of today, December the 29th, there are 65 new cases and 1,474 active cases of COVID-19. And out of that number, 22 patients are currently hospitalized, 2 who are in the intensive care receiving hemodialysis. Sadly, 716 persons have lost their lives of COVID-19, and through this event, we extend our prayers to the families who have lost loved ones during this pandemic. Included in this number are the very many healthcare workers on our front line. This year, their service and contribution to our country will not be forgotten. To the healthcare and frontline workers who continue to serve during this 4th wave, we express our sincere gratitude and appreciation to your dedicated service. Ladies and gentlemen, as we take note of the global local COVID-19 trends, your government will continue to make timely and essential adjustments to the health services rules to ensure that public safety is a priority. As stated in a press conference sometime last week, we say that the rules are fluid, and today we will outline plans to mitigate the spread of the virus and provide health services for those affected. As your new minister, I have been working very closely with healthcare professionals in my ministry over the past 3 months, preparing for the possibility of new waves of this virus and to better address some of the challenges we encountered during the difficult COVID-19 3rd wave. By way of health services rules, we have tightened testing at our borders to reduce the importation of new cases while refusing to give approval to mass gatherings throughout the country that can easily be super spreader events. But one of the most pressing issues we face in healthcare delivery is the shortage of nurses, doctors, and support staff. I am pleased to confirm that next week we will bring on board 12 additional doctors. We are also in the final stages of recruitment exercise to add an additional 50 specialty nurses to our healthcare system to provide essential services, and we pray that the contracts will be finalized by next week. Our nurses and doctors have gone beyond the call of duty despite outstanding industrial agreements. I have spoken with the Honorable Prime Minister and these outstanding matters, and I assure all involved that the negotiations will begin early next year to finalize these matters and begin the long-awaited promotion exercise across the board at the Ministry of Health and Wellness. Another important component in our fight against this virus is sourcing new COVID-19 drugs. We recently signed contracts to acquire these drugs, including monoclonal antibodies, which have been proven to be effective for rapid recovery from the virus. We are all aware of the space challenges we experienced during the last wave. I am happy to report that after negotiation with the University of Bahamas, my ministry has temporarily acquired the Grosvenor Nursing Building, and a contract will be awarded next week to begin the necessary renovations needed to transform that building into a much-needed infectious disease ward to aid in our fight against COVID-19. At its completion, we expect to be able to accommodate an additional 100 COVID patients at that location should the needs arise. This additional facility will finally allow us to free up the South Beach Polyclinic and bring that clinic back into service to provide essential primary health care services for the community. As discussed on numerous occasions, one key element in our fight against COVID-19 is the importance of testing. The sooner people know their status, the sooner the appropriate action could be taken to isolate, provide necessary care, and prevent exponential spread. In partnership with private sector labs, my ministry will begin offering free rapid antigen tests for asymptomatic residents at multiple centers throughout New Providence as part of our ongoing pilot testing program prior to the launch of the government national free testing program once the digital platform is completed, and that we can finally marry once and for all free testing with contact tracing. We know that the Omicron variant is more infectious than any other strain that we have seen. When someone laughs, sings, coughs, sneezes, or simply breathes, the droplets they expel can spread to others who are in close proximity. We also know that some of the droplets can linger in the air and land on surfaces. This is why frequent proper hand washing, maintaining distances of 6 feet from others, avoid crowded spaces, and cleaning, disinfecting regularly, and wearing a well-fitted mask indoors and outdoors when you are around people is important. As is recommended, regardless to the vaccination status, that you can double your mask or wear a medical grade mask. It's important to understand that your government will embark upon the distribution of free medical masks at various vaccination sites starting this week in New Providence, taking into consideration that New Providence is now classified as the epicenter for the Omicron virus. We know from the science that patients who have been vaccinated are less likely to be hospitalized and die from COVID-19. And vaccines are safe and effective against the severe effects of the virus. I am pleased to report that our vaccination program noticed an increase, an uptake in the last 2 weeks. And as of December the 23rd, 303,939 doses of vaccines have been administered throughout our country. 1,33 people are now fully vaccinated across our islands, which is about approximately 50% of our population. We are not there yet, and we want to be in a position and an opportunity to say that our citizens are fully vaccinated. I also want to thank the nursing, healthcare professionals, numerous volunteers, our Royal Bahamas Defense Force, police officers who continue to ensure that vaccines are delivered and administered throughout the Bahamas at our vaccination centers and pop-up sites. While many have responded to the call to be vaccinated, we are still experiencing some vaccination hesitancy in our population. It is important to bear in mind that reducing the spread of COVID-19 is not only important for the health and well-being of each of us, but it is also critical to the continued growth and development of our economy. We will therefore continue our effort through public education to properly inform the general public of the need to be vaccinated, and we encourage persons who have not been vaccinated to do so as soon as possible. We may visit the website at the Ministry of Health and Wellness, or you can contact our vaccination centers, ones closest to you. I would also like to take this opportunity to remind the general public that in October, we enter the flu seasons, which will last until March of next year. Remember, the flu has symptoms similar to those of COVID-19, such as fever, cough, muscle aches, sore throat, and runny nose, and too can cause severe illness. The flu vaccine is safe, it's effective, and available at no charge at our public health centers. You can also receive your flu shot when you go to our COVID-19 vaccination centers. It is recommended that all eligible persons over the age of 6 months, get their annual flu shot. Ladies and gentlemen, as the end of the year draws nigh, I wish you peace, prosperity, good health for the year to come. I encourage you to continue to partner with the Ministry of Health and Wellness and to make sure that you act responsibly as it relates to your own health and the protection of your family. I know many of you are experiencing COVID-19 burnout, but let's remain focused and practical and diligent as we follow the healthcare protocols as we go through this fourth wave together. I close by reminding you from the words of 3 John chapter 1, verse 2. Beloved, I pray that you prosper in all things and be in good health as your soul prospers. I wish you a happy new year, and may God bless us all, and may God bless the Commonwealth of the Bahamas. I now invite our acting Chief Medical Officer to give a brief presentation, after which we will open the conference for questions from the media. Dr. Swan.
Thank you, Minister. Honorable ministers, colleagues, members of the press, ladies and gentlemen, good afternoon. As we begin to look at the data and trends, we pause briefly to take a look at where we are today compared to where we have been during the early phases of the COVID-19 pandemic. Our most prominent waves were the second and third. And what we see here is that we had a period with low numbers of reported cases at the end of the highest part of wave 3, at Epi week 44, and about 49, where we reported on average 80 RT-PCR results, or 10 to 12 per day. During that period, our hospitalization rates were also low. Over the course of our national experience with COVID-19, what has been revealed is that over the past 2 years, in 2020 and 2021, Epi weeks 30 to Epi week 43 have been associated with high rates of community spread or infectivity. These Epi weeks correspond roughly to the end of July to the end of October. These peaks are then followed by a period of lower activity lasting for about 15 weeks. Mindful of this pattern, the Ministry of Health and Wellness cautioned the general public that though numbers were low, the expectation was that in the same period, or if the same period had transpired, this would translate to around early March 2022, when we could expect an increase in cases. The ministry has been actively preparing during an intervening period to reassess, recover, and restore health services, not only for a rebounded experience, but also for a more resilient approach to the delivery of routine health services. However, these plans were short-circuited by the new and more infectious strain Omicron variant, exacerbated by the reported relocation of about 50 or so nurses to other jurisdictions. During the period leading up to today, extensive assessments were made to address the management options for COVID-19. Discussions and preliminary arrangements were made to recruit additional nursing staff while reconsidering how the delivery of nursing-type services were supported, strengthening physician numbers, expanding spaces where monitored healthcare could be delivered to potentially a larger portion of patients, and the expansion of access and availability of medicines and therapeutics to mitigate against the negative health effects of COVID-19. These efforts were redoubled in the last 2 weeks as reports of the behavior of the Omicron variant were recounted across the globe. The previously implemented activities were continued and enhanced where necessary: public and social health measures, media awareness and vaccine campaigns. Minister Davil would have walked us through those arrangements and their current status. My role here is to talk about where we are in the pandemic from an epidemiological perspective and to bring some clarity to the purpose behind some of the policies that have been implemented and recommended. Last week, Epi Week 51, the Bahamas recorded the highest number of positive cases, presently standing at 970, which surpassed the 888 cases reported in Epi Week 33 of mid-August of this year. This is significant as it represents 4.7 times the amount of cases reported just the previous week of Epi Week 50 at 207 positive cases. About 3 to 4 weeks ago, during our weekly review, the Ministry of Health and Wellness noted changes in the source of our numbers for reported positive cases. We noticed that a greater proportion of our cases were among travelers, ranging from 30 to 40%. It was at that time that we began conversations with fellow government agencies on steps to tighten the net around testing requirements to enter the country. The review of available data indicated that a reduction from 5 days to 3 days prior to travel was acceptable to both sides of the coin, and that the movement to accept only RT-PCR would be best given the options available. Analysis of the reduction in time of testing before travel suggested that we could exclude up to 50% of persons who had tested positive in the 5 days after traveling to the Bahamas. Another point for comparison would be the positivity rate and moving averages, but we don't have those data because that comes as we look at the previous 2 to 3 weeks to provide for you. At the community level in country, the ministry increased public awareness efforts to encourage the general public to adhere to the proven public health safety protocols and infection prevention measures such as the wearing of masks, the adherence to sanitation practices, and physical distancing. We also ramped up the vaccination campaign by introducing pop-up sites to increase access to vaccines. When vaccination numbers stalled, we used giveaways and other incentives to get the public interested, all in an attempt to improve the country's experience with the impending fourth wave. However, the reality is that the fourth wave is here, and so we need to figure out what is the engine that is driving this wave and how we can mitigate it. So who is testing positive? In order to answer that question, let us explore it. A comparison was taken of the experience of the first 3 waves of the COVID-19 pandemic and comparing it with the most recent surge in cases. The age spectrum indicates that this fourth wave has started among a slightly younger demographic, those aged 20 to 29, with the older population being less impacted at the moment. There is a variation in the sex distribution, with 53% of the cases in the fourth wave being represented by females. Where are the cases? Once again, predominantly the majority of cases are being reported in New Providence. There are other islands that Minnesota mentioned earlier where cases exist but at lower rates. And also what is noted is that a significant amount of the spread is occurring in home settings and in the workplace. Both suggest that persons are out and about, not adhering to recommended protective measures, and taking the virus home to their families. We once again reiterate the importance of adherence to protocols at all times. The illness spectrum and impact on services reflect that most cases that have been presented for care so far have been mild. In fact, during Epi Week 51, there were just about equal numbers of persons hospitalized with a positive COVID test result and those who would have been admitted to hospital for the management of their symptoms. For the last 4 weeks, our point of reference for this new activity, the number of hospitalization has hovered at daily occupancies between 50 and 20 to 30, with about 2 to 3 remaining requiring advanced care. This may be an early indication that in the Bahamas, the Omicron variant may cause a more mild disease, but we are still fairly early in our experience and are cautious in making that conclusion. We are still preparing for the worst, as the baseline health spectrum for the Bahamas is unlike any other country in the world. Most symptoms are headaches, stuffy nose, and some dizziness and shortness of breath with a cough. As we move on to the state of preparedness of the health system and the population, our testing supply is in capacity at the moment. We have the capacity to support the completion of about 13,000 molecular tests in the public sector, and this includes our testing centers in New Providence and Grand Bahama. And Mr. Darwell would have announced the engagement of private laboratories in New Providence as part of a second phase of provision of access to free COVID-19 testing as part of our mitigating strategy. These private-public partnerships will expand testing options at no cost to residents who meet the requested criteria. Our vaccination rates. The vaccine campaign started with the first doses being administered on the 14th of March 2021. Up to the date of this report, 306,199 doses have been administered in the Bahamas, and this accounts for first, second, extended primary series, and booster doses. Booster shots began on the 6th of December 2021, and to date, 10,299 booster shots have been administered across the Bahamas. At the close of business on the 28th of December, there were 714 fully vaccinated persons in the Bahamas. Of this number, 11,108 were 12 to 17 years old, and 5,891 were persons who were fully or partially vaccinated outside of the country and registered their vaccination status online at the vaccination portal. The percentage of vaccinated persons is based on a number of persons eligible to receive the vaccine and not the total population. And as a reminder, ladies and gentlemen, appointment slots remain open for booking across the archipelago. As of the 22nd of December, persons who receive one or both vaccination doses outside of the country are able to receive booster shots at any vaccination center or clinic across the archipelago. Our greatest vaccination rates by age group are among those persons aged 60 years and older, with a rate as high as 70% among those 80 years and older. As it relates to hospital capacity, at last report, we have access to over 100 beds at PMH alone, and several more are available at Doctors Hospital and in Grand Bahama. The South Beach Health Center is still potentially a space to accommodate more patients, but given the creation of new clinical spaces for COVID-19 positive patients on the PMH compound, it is anticipated that this site, as a place for patients, will be fully decommissioned by next week as the South Beach Clinic, where we hope to once again begin accommodating primary health care services, beginning with the adult non-pregnant patients. The School of Nursing project is expected to add a further 49 beds to the first phase, with additional plans still pending for field hospitals for both New Providence and Grand Bahama. As we look at our human resource situation, reports from across the COVID-19 treatment centers, including the private and public sector, reflect that at present a significant number of healthcare workers are either in isolation or quarantine. As you can imagine, this has implications on the already limited capacity to support clinical services related to COVID-19, as well as unrelated to COVID-19. The advisory committee has undertaken to discuss further options to support the health system in this regard by the revision of protocols with recommendations. It is anticipated that the staff recruitment exercises outlined by Minister Darwell provides an immediate relief to the present situation, while more long-term strategies are explored to replenish and sustain our supply of healthcare providers in some areas and improve our baseline numbers in other categories across all the health sector. When it comes to medications, therapeutics, remdesivir, which is used for the management of moderately ill to severely ill patients, remain in steady supply and a good inventory level exists. The ministry has placed its first order for monoclonal antibodies yesterday and are awaiting their arrival in country. The Bahamas is also part of a request and expression of interest in Paxlovid, the new oral treatment modality by Pfizer, as part of the Caribbean Public Health Agency's CARPH's request to the government of the United States. This request also included pediatric doses of the Pfizer vaccine. We are made to understand that our levels of PPEs are also acceptable, while more are on order to ensure the protection of healthcare workers and other frontline workers. As part of mitigation efforts at the community level, in addition to messaging about the need to adhere to public health safety measures, the government has identified a supply of masks for distribution to the general public. Prevention measures. As is widely known, the best treatment for any malady or illness is prevention. And in this vein, the ministry has identified several actions to reduce the spread of COVID at this time. At the border, in collaboration with the ministries responsible for tourism and immigration, We have advanced recommendations for the reduction of the validity of a test prior to entry into the country, and have made representation for that test to be a molecular one, which has a great ability to identify the Omicron variant in particular. There have been a number of questions on what is the accepted practice for quarantine and isolation in country. The Bahamas has not adjusted its definition and practices for quarantine and isolation as yet. The CDC recommendations are just that, recommendations, and they're geared towards the U.S. experience. Even in their recommendations, individual states and sometimes counties have the ability to adjust, adapt, or adopt the recommendations. The Ministry of Health and Wellness is cognizant of the recommendations and have committed to considering the relevance or appropriateness of those to the Bahamian context in the coming days. We have made a determination on the application of isolation for healthcare workers and frontline workers, which will be shared with the relevant institutions before making public. We have also made plans to revise the quarantine requirements for the same category of staff. Until that occurs or a change in current practice is communicated, isolation means that each person that tests positive for COVID-19 is to remain separate from others as far as possible until the minimum of 10 days or 3 days after symptoms resolve, whichever is longer. A person under quarantine is an individual that has been in the presence of another individual, symptomatic or not, that has subsequently tested positive for COVID-19. That's the individual whose presence they were in. The present requirement is for that individual who was exposed to the positive patient will remain separate from others or gatherings as far as is possible for a period of 14 days. We have recommended the suspension of all large or mass events for the immediate period in an attempt to stem the increased number of reported positive cases, which, while it may not have an impact on our health services capacity, may impact our CDC level status. I'll spend a bit more time on the idea of our prevention measures. Protection measures, a mass event speaks of events that are outside the limits of 20 in indoor settings and 30 in outdoor settings. The Ministry of Health and Wellness has recommended that all mass events are suspended until further notice, and this includes those previously approved and those pending requests for approval. We also encourage citizens to not attend or participate in these events, as we believe it will dramatically increase your exposure to and likelihood of developing a COVID-19 illness. Businesses, churches, schools, and restaurants have separate guidelines that govern their behavior, and thus for indoor gatherings, there are different rules that apply to these entities. During the earlier waves of COVID-19, various industries submitted and received approval for protocols and guidelines that spoke to how their operations were to work. These guidelines have not been suspended or revoked. They are still the parameters that the Ministry of Health and Wellness expect businesses and other industry operators to abide by. The Royal Bahamas Police Force has been invited to once again jealously enforce all protocols and provide some feedback on any challenge experienced before the ministry considers recommending additional control and restrictive measures to protect the public's health. Special mention is required to entities that sell alcohol alone. These are businesses and must abide by the stipulations laid out in the health services rules pertaining to occupancy levels based on square footage parameters. If these establishments are also restaurants, the rules also provide parameters for their operations. Churches presently, during this uptick in cases, have agreed to operate at 25% capacity. This concession is greatly appreciated, and we know will augur well for protecting congregants during this challenging period. And before I get to my last set of comments, I would like to take this time and echo Minister Darville's sentiments to express our deepest gratitude to all healthcare workers and frontline workers. Without your unselfish dedication to excellence and preserving the quality of our little country, we may not be experiencing the measure of comfort and success that we are at the moment. That is not to say that we don't still have a ways to go. And thanks as well to the general public, who have been steadfast, for the most part, in adhering to the public health and safety protocols that have been advanced. There is a little more work to be done to ensure that our numbers get back to the level of control that we would like to see. As I conclude, I thank you for your attention and for your perseverance through these past 21 months of the COVID-19 pandemic. It has not been an exercise in futility, as we, as a country, are much further along living with this disease than we were when we first began. That being said, each one of us as individuals is at a minimum responsible for his or her own health. For those that have children or are caregivers for others, that responsibility extends to those persons as well. The greatest policing mechanism that society has is each other. We must work together to ensure that our practices not only preserve our own health, but operate in a manner that our activities and behaviors do not impact the health and well-being of others. We are our brother's keeper. I turn over now back to Minister Darwell for any questions you may have.
Thank you so much, Dr. Swan, and I would like to let the viewing audience know, due to the protocols here at the Office of the Prime Minister, there is little or anyone in the studio, and so the entire conference or press conference is virtual, and to first of all thank all of our reporters who have agreed for this type of conference. And before I get started with the questions, I would like to thank the Bahamian people for their patience and to let them know that the Ministry of Health is not their enemy. The Ministry of Health and Wellness is their protector. And we are privy to information that is very technical and sometimes difficult to break down in common terms. With me virtually, I have Dr. Indira Martin, who is responsible for our national lab. I have Dr. Gillian Bartlett, who is responsible for our family islands. I have Dr. Frank Bartlett, who is in charge of the northern Bahamas, mainly Grand Bahama. I have Nakira Forbes, who is infectious disease specialist, and I'm fortunate to have with me Minister Glenna Hannah Martin, who will be prepared to answer any questions as it relates to schools, opening of schools, and where we're heading to get our kids back into the classroom. With that being said, I would like to first open the floor to Ms. Jones of Eyewitness News for the first question. Jones?
Good afternoon, Minister.
Okay. Thank you so much. I know there's a delay.
Sorry about that. Right now, hospitalizations are low, but we know that could change very quickly. So I note that there are additional efforts to acquire doctors, nurses in particular, who become impacted by this highly transmittable strain. But what is a contingency plan when more nurses and we can supplement get impacted by quarantine requirements as they get exposed?
Thank you for the question. Dr. Swan tapped into the answer for that question. As we review the CDC rules as it relates to quarantine and isolation, we are monitoring what's happening around the world, and it is moving in a direction where individuals who are vaccinated, who are exposed to COVID-19, and who subsequently become positive, whether it's a rapid antigen test or a RT-PCR test, may be eligible to have a shorter isolation time and get back to the affairs of the hospital in a shorter period. We're seeing other countries around the world doing it, and for us, with limited healthcare resources and manpower resources, we have to be innovative in our approach. But like I said before, we understand the potential shortage, and so an additional 12 doctors will be added to the Princess Margaret Hospital and our outpatient clinics effective next week. This will definitely create more arms, technical support to the existing healthcare team. And with nurses coming on stream, particularly specialty nurses, it will alleviate a burden that presently exists that can be compounded by nurses actually being taken out of the system because of exposure or contracting COVID-19. So we do have a plan, and we will begin to execute that plan as early as this week, but will be in full force effective next week and the weeks going forward. Your second question, Mr. Jones? Or we go to Tyler now. Tyler Simonet, JCN News.
Good afternoon. We know, Dr. Darville, you did mention that the free testing program will launch a pilot program in Nassau before officially being launched nationwide. I know you also mentioned that you hoped the pilot program would be up and running sometime this week. Do we have a more solid timeline as yet? And also, do we have a number on how much the free testing program will cost taxpayers?
Well, first of all, thank you for the question. For us, in our pilot free testing program here in New Providence, I've made it very clear that we intend to have free testing and mass giveaway at sites where we have vaccination ongoing. This particular free pilot program will be the jumpstart of the final analysis in the epicenter, which is New Providence, on how we will roll out our free national testing program that is tied deeply into a digital platform that will marry free testing with contact tracing. Free testing is absolutely a part of the government's strategy in the fight against COVID-19. And the pilot testing program, we intend to try to keep the program to a level where there is no more than about $40,000 to $50,000 per week. We understand that this particular program requires integrating with the private sector, and those discussions are ongoing. And if I'm not mistaken, that is completed. And we have done this private sector or private-public partnership with labs in Inagua. We have done it in the Berry Islands, in North Eleuthera, and Bimini. So we have a template on how it's done, but it's a little bit difficult to truly come up with an exact figure because it is directly tied in with the response from the general population. Rapid antigen testing of asymptomatic individuals throughout New Providence is essential for individuals to know their COVID status. We believe that many in our community are very compliant, and if they do have a positive test and are asymptomatic, that information will be forwarded to our contact tracers, and the necessary isolation as well as quarantine programs will be activated. I would step aside and allow Dr. Moxie, whose name I didn't call, to come up to see whether or not she wants to add to that.
Happy holidays, Bahamas. Minister would have articulated the broad strokes and parameters of the free testing program that the Ministry of Health seeks to implement in the short term. We would like to say at this juncture, though, that those entities that are involved with rapid antigen testing, they ought to be approved by the Ministry of Health. They ought to be authorized by the Ministry of Health. This is very significant and important, particularly when it comes to us being able to give the public full and comprehensive information with regards to what our COVID-19 situation is looking like. We currently have entities that are not authorized by the Ministry of Health that are doing rapid antigen testing. And this does not feed into our national numbers, nor does it give us the opportunity to contact trace. And so we are asking the public to be mindful, to be diligent consumers as they go out there to get their rapid antigen tests done. And this, of course, is all until we get our digital platform and the mass testing up and running. At that time, it would be, I think, a little bit more clear to the public who those authorized facilities are. So again, just be diligent consumers. If you go to have a rapid antigen test done, ask the entity if they've been authorized by the Ministry of Health and to show you proof of that authorization. Thank you, Minister.
Thank you so much. Scott from the Nassau Guardian.
Good afternoon. I know that we have seen a rapid increase in new COVID-19 cases. It also seems like in the latest dashboard, hospitalizations increased slightly. Given that plans were underway for schools to reopen or resume a hybrid format with students going to in-person classes at least a few times a week, is that still in the plans, or are those plans being reconsidered given the recent surge in cases?
Thank you so much, and thank you for the question. The answer to that question is the plans are definitely being reconsidered, and we have decided to postpone the opening of schools for an additional 2 weeks as the Ministry of Health epidemiological team assess the data that's coming in. It is not, in our view, a good thing to open schools in the middle of a pandemic, and so we have decided to wait and act with a degree of caution to ensure that we open, and when we do open, we open so that we can stay open. I would also like Minister Glenn Martin to join in as it relates to schools and her ministry to add to what I've said. Dr. Martin? It's two Martins, sorry. Dr. Glennis Hannah Martin. Minister Glenna Hannah Martin, are you there? I call you doctor.
I think that for now. Thank you very much.
Okay.
Yes, I'm here. I'm here. Can you hear me?
Yes, loud and clear.
Thank you. Thank you. No, sorry. No, my internet is intermittent, and so please forgive any in and out. As you've indicated, we have been really pushing for schools to open. Children have been out of school or not out of school, but in a virtual mode for many, if not all, and challenging for some, really challenging. And so we have been trying very hard to get schools open. We have accelerated our contractual works with the construction through Ministry of Works. The schools are all poised to be ready to reopen, and unfortunately, we will not be able to have children in on a face-to-face basis, teachers, and however that will work. And on the 11th, for students on a fully virtual basis, until we have been able to be given, I guess, more liberal instructions or advice from the Ministry of Health. This is a very challenging time for education in our country, and we are seeking very earnestly to see how we can minimize this disruption in our country. We can do it, and we're facing challenge and some obstacles, but we will not rest until we have done all that we can to ensure that despite all of these things that are beyond our control,
Thank you. Sorry. Continue, Minister Martin. There's a delay in the transmission.
I'm sorry about that. I'm operating from home right now. So, you know, the bottom line is we're advised by the ministry, members of the community, and we will be monitoring this, and so that school will reopen on a fully virtual basis thereafter. We will come back to the table, assess where we are to see whether we can get children back into the classroom. Of course, we will be guided by the Ministry of Health at that time, all begin to get children back into the classroom, but we want to do it safely. And so that's where we are at this moment.
Thank you so much, Minister. And for the general viewer, I want to let you know that we are holding a virtual conference. Some people at different locations, and in some instances, there may be some delay. So please bear with us. The next question is to Jasmine Brown of Our News. Jasmine?
Good afternoon. Yesterday, outside Cabinet Minister, you had indicated that some wards at the hospital have been impacted due to COVID-19 exposure. And today, the acting CMO has mentioned that a significant number of healthcare workers are either in isolation or have contracted COVID. Wanted to know if we can get numbers on the healthcare workers as well as the names of the wards that were impacted. And does this expand beyond PMH to any other public healthcare facility?
Well, yesterday I did mention that as a result of the very transmissible variant that is in the country, some of our physician and nursing staff have been exposed to COVID-19 and are subsequently in isolation and quarantine. The name of those doctors and nurses, I think, may be going a little bit too far, but they are out. They are in good health. They are doing extremely well, and I would allow Dr. Forbes to elaborate on what is happening at the Princess Margaret Hospital. And when she is done, I would allow Dr. Bartlett, Frank Bartlett, to speak of what's going on at the Rand Memorial Hospital. Dr. Forbes?
Thank you, Minister. Good afternoon, everyone. And so we have to be aware that in the Omicron surge, that it's highly contagious, and so a large number of persons can get COVID-19. And this is across the nation, and we're seeing this in other spaces too. Now, what this is translating into is that in hospitals and facilities, there are patients that are presenting with other problems, say a broken leg or trauma or another medical problem, that are subsequently determined to be positive. We do screening on admission, but it is possible that their admission COVID test is negative and they can become positive later on. Out of safety, we then have to put contacts in quarantine, and so that can result in wards that are closed. What is particular about the Princess Margaret Hospital is that on the wards, we have what's called a Nightingale nursing system where the wards are open. And so what then happens is that wards are subsequently closed until patients have been tested and are either negative or develop COVID-19, whereupon they go to the COVID care areas. So this is not unique only to Princess Margaret Hospital. It does happen in other care facilities, and it is happening in international spaces too. Unfortunately, because of the situation with those open wards in Princess Margaret Hospital, we do have a number of the wards closed, and we project that some of these wards will be out of their quarantine period and be able to reopen as soon as this afternoon or tomorrow. And healthcare workers can also be exposed in this way. We do continue to put mitigation measures in place, including testing on admission and screening checks, and also providing personal protective equipment for healthcare workers and encouraging vaccination among healthcare workers so that can minimize what is called nosocomial transmission, or infections that happen in the health workspace. As it relates to the current hospitalizations at Princess Margaret Hospital, this morning we had 17 COVID positive patients across our care areas, including the legacy unit, which is an infectious diseases unit, and the special pathogens unit, which was once called the Samaritan's Purse tents. Because of what we have described about Omicron, few of those patients are actually admitted for COVID-19 pneumonia. Less than half of those patients are admitted for COVID-19 pneumonia. And a number of those persons who have tested positive are indeed there for other medical problems, but they are in the isolation wards. We continue to try and mitigate against this, and it is going to be a challenge. It is a challenge here at home and in international spaces and health facilities, behooving us to continue to work to improve the system to minimize exposures of that kind. Thank you.
Thank you so much, Dr. Forbes. Dr. Frank Bartlett, could you give us an update at the Rand Memorial Hospital?
Good afternoon, everyone. As it stands in the Rand Memorial Hospital, at this point in time, we have 6 persons hospitalized. That's inclusive of 2 persons who have tested positive for COVID, and we have 4 persons under investigation. Our surge here in Grand Bahama started December 9th. Over a period of 2 days, we would have gone from having a break for 2 weeks with no admissions to hospital to 9 over a period of 2 days. We would have peaked at 20 persons, and right now, as I would have mentioned, we have 6 hospitalizations. We had exactly the same number yesterday. Those 4 persons who were under investigation, meaning they were waiting their final disposition based on the testing, those tests would have subsequently turned out to be negative. So as it relates to any type of significant exposures and challenges with hospitalizations and accommodating our clients here in Grand Bahama, we don't have really any of those issues at this point in time to have any challenges with. As it relates to the number of persons in quarantine, in Grand Bahama right now, we have 7 healthcare workers in quarantine. That is inclusive of 4 front line workers. That's 2 nurses, 2 doctors, and then we have 2 of our support staff that are actually in quarantine. All the persons who are in quarantine would have been either exposed to or contracted and would have done testing, for example, say for travel purposes outside of the environment. So as it relates to having any significant exposure in Grand Bahama at the hospital at this point in time, we don't really have a significant challenge with that. Over.
Thank you so much, Dr. Frank Bartlett. If I can get Dr. Jillian Bartlett to speak a little bit about what is going on in the Family Islands, particularly in Inagua, Maikal, and coming in from Cat Island all the way to Exuma. Could you give us an update on what we are seeing as it relates to where we are in this 4th wave? Dr. Bartlett? Jillian Bartlett?
Good afternoon, Bahamas, and season's greetings to all. Minister, good afternoon. So across our family of islands, we were quiet for the most part in most of our islands. As you can see by our second schedule, we only had Inagua and Eleuthera on. But as we progress, we are now also feeling the effects of the Omicron virus across our family of islands. In the Maikal area, as I would start from that, Minister, as your request, in Make One remains relatively quiet still with no COVID activity. Inagua, though, just recently this week has 4 active cases, all by rats, and a number of persons in quarantine as a result. We are understanding that some event was on the island that may be a potential cause of what we are seeing there. But the healthcare staff is working diligently, as they always do, to contain what we are seeing with the rapid testing, the isolation, and the contact tracing on that island. Crooked Island remains relatively quiet still, along with Acklins. This week, we only have 1 PUI in Acklins. So Acklins remained relatively quiet with 1 PUI and 2 persons in quarantine. As we come up the chain, Exuma has potential activity with 39 active cases distributed along the mainland, Daniel Key, and in Black Point. Farmers Key remains quiet. Most of the cases are on the mainland, and most of those we are seeing in the foreign tourist travel. So we are doing what we always do as the healthcare team on the ground. We are diligently observing for any persons presenting with symptoms, doing the necessary testing, isolation, and the necessary contact tracing so we can mitigate and minimize the spread along the Keys and Exuma. As we come up to the other major islands, Eleuthera is still having an effect, and therefore they remain on our second schedule, particularly in Harbor Island, where we've seen a nice spike there, along with second homeowners and travel related as well. as well as in the central area and a few on mainland. South Eleuthera remains relatively quiet, but Eleuthera on the whole has seen an uptick as compared to what's happening last week. The other islands, Andros remains relatively quiet, both north, central, and south. Abaco, we see slight increases there, but nothing unmanageable. Slight uptick in the Marsh Harbor area. There's 1 or 2 cases, 4 to be exact. All rat tested on Baker's Bay and Guanaki and Abaco. South Abaco remains quiet, Sandy Point and Moores Island. We also now, with the other islands, Cat Island has no active cases, but we have a substantial amount of persons there, 31 to be exact, in quarantine as a result of an exposure there. And so that's Cat Island, Andros, Abaco, and the Michael area, Ixoma and Eleuthero. Those are the major islands right now. And we are concerned, of course, of the major concern now also is in the Berry Islands. Sorry, I missed the Berry. Berry Islands also seen a great uptick with 15 active cases, 10 on Chub Key, 2 on Great Harbor Key, and another 3 on Cocoa Key. So most of these are rapid, with the 3 exception of the 3 in Cocoa Key. Rapid symptomatic persons that are presenting. And as we know by the national testing protocol for the rats, that the positive symptomatic persons by rats are considered the case. So they would be managed the same as if they were PCR, real-time PCR positive. So across the islands, we are managing. It's not unbearable at this moment. Minimal effect of healthcare workers. So they continue to do what they normally do with the symptomatic, the testing, the isolation, quarantine, and the contact tracing. We remain resilient in this fight across the archipelago. Thank you, Minister, and thank you.
Thank you so much, Dr. Gillian Bartlett. What we would like to do, I know we have Rashad Roll is the next media question, but I want Dr. Swan to come up and speak about the impact the Omicron variant is having in our healthcare system, particularly at our clinics. For the general population, it's important to know that there's about 90 plus clinics extending across our archipelago, and we are providing healthcare services in those clinics with concentration in about 23 to 28 clinics. And so it's important to know how the Omicron variant is affecting the delivery of healthcare services and individuals who have been exposed, particularly in our clinics here in New Providence. Dr. Swan?
Thank you, Minister. So we know that there are about 25 staff out in our community clinics, at least 25 is 28 in total. That includes nurses, patient care assistants, clerks, janitresses, and physicians. So again, the numbers add up. Although we have about 91 plus facilities, the numbers add up and cause a challenge as it comes to sustaining services across the board. Minister?
Thank you. Thank you so much. Next question by Rashad Roll from the Tribune. Rashad?
Good day.
Yeah, thank you.
Yeah, this question is for Dr. Forbes. I know officials have long cautioned that the antigen test is less accurate at detecting COVID-19 than the PCR test. Does the current research or the early indications suggest that antigen tests are even less accurate at detecting the Omicron variant compared to earlier strains of the virus, or is it more or less the same?
Thank you, Mr. Rowe. And yes, there is early information that the rapid antigen tests may be less accurate and likely to pick up COVID-19 cases from the Omicron strain. And what does this translate into when we are looking at our practice and what we do is that if you are having symptoms and you have done a rapid antigen test and it is negative, you should follow that up with a PCR test. And so we do have to be mindful of that. And our technical team is looking closer at that to see if we will change any guidance. And two, when it comes to our travel and testing related to travel, very soon PCR testing will be the test that is required to enter the Bahamas in an effort to be more accurate, sensitive, and specific. Thank you for your question.
Thank you. Keishla Adley from ZNS, your question, please.
Yes, good afternoon, everyone.
We lost you, Keishla.
Everyone was a little stunned about the Christmas Day results.
Keishla, the question.
Is that better?
Yeah, can you start over? The transmission
Yes.
was not up to par. Thank you.
Everyone was stunned by that 330 number recorded on Christmas Day, though it was since explained that those numbers may have been are into this fourth surge. Are linked to persons who are required to do testing for job purposes. I'm wondering how confident you are or comfortable you are that the numbers that you're getting in on a daily basis are really reflective of the number of persons out there, especially considering, like Dr. Forbes has just referred to, how accurate the PCR test or the rapid tests may be.
Thank you so much. Dr. Swan, you want to start that question, and then we would forward the question on to Dr. Forbes. Thank you.
Thank you, Minister. Thank you, Ms. Adley, for your question. Sorry, the reality is that when we report on a daily basis, we report the number of test results that the surveillance unit receives. We know that varies because we have various response times in labs across our network. And so we report what is received. When we make our determinations and as we provide you with updates later on, you would notice that number may change or may reflect differently on our presentations. And that's because what we track are the number of tests that are positive that are conducted on a particular day, the so-called the collection date. And that gives us a better idea as to what is happening with the pandemic in country. So on that data, we had 330 reported, which usually reflects the number of tests that were done the day before, which is Christmas Eve, I think it was. The actual number of positive cases was still high. It's about 260, I think it was, of tests that were reported. So we usually wait until 2 or 3 days later, and sometimes up to 3 days later before we look at numbers to make a determination in terms of what has happened in the previous week. But we are very close to ensuring that our lab systems are connected to our information systems so that we're able to get more accurate information to you on a regular basis. But it is a challenge, and we're trying to work through it. Thank you.
Thank you. Thank you so much, Dr. Swan. If I may add to it, one of the challenges we have with our rollout of free testing married to contact tracing is to ensure that labs that are affiliated with our free testing program report the tests in real time. It's very important for us because putting it in real time, it gives us a better analysis of the data. And so we will be able to monitor what's going on in the country, and the information that goes to our contact tracers are usually within a 24-hour period, which is essential in order for us to do a better job to be able to quarantine individuals who are exposed to that live case. And so as we speak of our pilot free testing program that is scheduled to be launched this week in New Providence, we speak specifically to the rapid antigen test. The rapid antigen test is a screening test, whereas the RT-PCR test is a diagnostic test. And so what the rapid antigen test gives the individual a clear indication of whether they are positive or negative. If they are positive, that particular individual will know that it is important for them to go into isolation until such a time as an RT-PCR test can confirm fully the diagnosis. If the RT-PCR test comes back negative, the individual now have the ability to move out of isolation. But if no RT-PCR test is done, that individual remains in isolation for the 10 days, and individuals who are associated with that individual probably for the 14 days. These things are being worked out, and is a very important algorithm that we must solve prior to the rollout of our national free testing program. The second question for you, Ms. Adley.
Yes. My second question. Yes, my second question. The Prime Minister previewed the engagement of nonprofits, I believe he said, to deal with field hospitals or additional medical care where necessary. Is that something you foresee at this point?
Yes, we are in communication with NGOs, and the response have been excellent to assist us with medical supplies, testing equipment, PPEs, and the list goes on and on. That response has been excellent. We have also reached out to diplomatic partners in our country to assist us in the event that we find that this fourth wave becomes unbearable and we need additional support. So 6 weeks ago, we reached out to our partners to assist us, knowing very well that the potential of the fourth wave could have been more deadlier than the first, second, or third wave. And we will keep the media updated on our progress. But just today, we received a reply from one of our NGOs who are moving swiftly to bring relief to the Bahamian people via diplomatic channels and to ensure that supplies are in the country at the appropriate time so that we can be able to ride through this fourth wave with little casualties as possible. Thank you. The next question goes to Mr. Jones. Second question at Eyewitness News. For the viewing audience, this is a virtual conference, press statement and press conference, and so we are having some technical difficulties with the media with delays. But until that's worked out, can we go on to Tyler Simonet of JCN News?
Good afternoon. Just a follow-up, I guess, for just a little bit more clarity in regards to the testing. Are health officials recommending that individuals who do test positive for COVID get retested after quarantining and their symptoms subside as a means to re-entering society?
Dr. Swan, please answer that question for Tyler. Thank you.
Thank you for your question. So there are certain categories of persons who are placed on quarantine that require testing before they return to their community, but the general answer to that is no. Those persons we identified on quarantine, application of the quarantine measures rather, and along with their healthcare provider will make a determination as to whether or not they need to have that testing done. And the surveillance unit would also play a part in that process.
Thank you, Dr. Swan. Scott from the Nassau Guardian.
Good afternoon again. We have heard reports that there have been a number of cases at some resorts, on New Providence in particular. Is there any data on the number of cases or the number of people who have tested positive, visitors to the country who have tested positive and who might particularly be in these resorts, and also perhaps staff numbers? Are there any clusters?
Well, there's definitely clusters, and both in the public and private sectors, we are seeing some commercial groups who have clusters. We've seen and heard of clusters at some of our hospitals. We've heard of clusters in the tourism sector, but Dr. Swan will come to elaborate a little bit more on what we found and what we are doing to ensure that contact tracing is on the ball and we mitigate the possibility of even subclusters forming from those who have been exposed at the workplace.
Once again, thank you for your question. We did receive a report from a surveillance unit of 2 clusters this week that have been investigated. There was an earlier cluster as well that happened early in the month, but I'm not sure if they were actually associated with hotel properties. Okay, so I'm getting they're not, they weren't. Again, one of the things that we like to get the public to understand and appreciate is the information that the Ministry of Health operates with, that receives, gives action to, is based on the honesty of persons who are testing positive or who are being, so persons can be identified to go in quarantine, or so persons, so the unit can know that if you are at a particular place for an extended period of time and someone else tests who say they're also at that particular place at the same time, then we could connect you and make you and determine if that was a cluster event. If you say that all I've been to is work and home, we will never get the social engagement that you would have had with other individuals that results in us making the cluster formations. So again, the honesty helps us from a public health perspective, but as far as we know, there's 3 clusters rather, one pretty big, the others 2 not so much, and the smaller ones, as I mentioned earlier, are more persons in the same home or working in small businesses.
Thank you so much. Next question is for Jasmine Brown of Eyewitness News.
While we're on the topic of hotels, I asked this question outside Cabinet yesterday, and I noticed that we are limiting large events. However, there are events planned for hotels. There are clubs opened in hotels, especially New Year's Eve events. Given where we are now with the numbers and the charts we saw, will those events still be allowed to happen in hotels? I know they have rapid antigen tests that they use there, as well as vaccination, proof of vaccination, but will they still be allowed to have these events on hotel properties?
Thank you for the question. Yesterday, outside of Cabinet, I indicated that the Ministry of Health policies for large social events applies across the board. We've made it very clear that these events are potential super spreader events, and with the peaks that we are experiencing with the Omicron variant, it becomes very dangerous for individuals in close proximity to each other and large events which could be potential super spreaders. We have learned of some events that are scheduled at our hotel properties. We also understand the legal ramifications and the fact that our hotels are full and restaurants must be able to function. People need to go and eat. People want to have a social event. We are asking that all of the necessary healthcare protocols be adhered to, and we are definitely focused on longer and deeper communication with all of our resorts, because one of the things that we must take into consideration, in this administration, we were able, in the matter of 3+ months, to go from level 4 to level 2. That is not by chance. That is by planning and strategic intervention. When we move from level 2 back up to level 4, it affects us all. It affects commerce, it affects the tourism sector, it affects our travel, it affects us in many ways. And so I am asking the Bahamian residents and all of our hotel operators to take into consideration the possible effects if we begin to see spread, particularly exponential spread as a result of exposure. So we are asking everyone to act responsible during the next 3 to 4 days going into the new year. We have definitely not put any quarantine measures in place. We have not put any curfews in place. We're not talking about any lockdown. People are free to move about. But we are asking every Bahamian to work together so that we keep the viral load down in our community and to be able to monitor and control hospital admissions and reduce the spread of COVID-19 in our communities. Thank you. The next question goes to Rashad Roll.
Yeah, okay. Some people on social media have been asking if the current outbreak is so far restricted to New Providence, why would the postponement of the reopening of schools apply across the country? Can you discuss that?
I will let Dr. Swan, our acting CMO, discuss it because we're still collecting data. We have some data, and the whole issue of COVID-19 is very fluid. And what we may see today may not be what we see tomorrow. So the collection of epidemiological data is essential to policy making. And Dr. Swan, would you continue from there, please?
Thank you, Minister. And thank you, Mr. Rule, for your question. Yes, we are reporting low cases of RT-PCR positive persons on most family islands, but you have outbreak of cases every now and again that we track with. But there are, as I mentioned earlier, there are other parameters that we look at when we determine whether restrictions should apply. And from the metrics that we look at that are internal to the Ministry of Health, we find that there are some cases, or some situations, I should say, and Dr. Bartlett have articulated some of them, that warrant us to take a little bit more caution in opening up the family islands fully. Again, case-by-case basis, we're going to have that discussion, but at the moment, we're going to hold the line and just keep all schools at virtual for the next several weeks. Thank you.
Thank you so much, Dr. Swan. Rashid, we have had discussions with the Ministry of Education, Minister Glenahana Martin. We have looked at the fact that one hat don't fit all, but on the degree of caution and the unpredictability of what we are seeing as we collect the data, we felt it appropriate to postpone the opening of schools from the present date by 2 weeks, and we will report to the nation as it relates to that. Mr. Jones, I realize you're back from Eyewitness News. I'll take your question, sir.
Thank you, Minister, again. While the Omicron variant appears to be a lot milder based on the data we've seen internationally, although highly transmittable, and the number of cases or hospitalizations rather appear to be low, deaths appear to be low as well. So the severity is not the same. But what happens when the infection rates among the elderly pick up and the immunocompromised? What could we see then in terms of the danger of this virus?
Thank you so much for your question. I would start the question, and I would let Dr. Forbes finish the question. Your question is a very good question because the immunocompromised is a special group of individuals who have difficulty to fight infections. And the way an infection operates in someone who has excellent immunity differs from someone who is immunocompromised. With that being said, there is a strong possibility that these individuals could go from mild, moderate to severe COVID symptoms and subsequently can actually go into the intensive care. Dr. Forbes, would you like to add to that, please?
Good afternoon again. Yes, thank you, Minister. So, Mr. Jones, you have a very good point there. And we have to remember that what we need is scientific data. So at this time, it does appear that Omicron is milder. How do we know that? South Africa has described that. And in the South African context, their population is generally a young population. A number of persons had gotten COVID already. Naturally, in South Africa, they had some degree of immunity. Yet 2 to 3 weeks later, there was an uptick in hospital admissions. In the UK, they're also describing something similar. Hospitalizations are increasing, and in a paper that was published a few days ago, the age group of persons getting Omicron is largely in the 20s to 30-year-old age group. And so generally across the board, even with Delta and the original COVID strain, that age group tends to do better with COVID as opposed to the elderly persons and persons with medical problems who are more likely to end up in hospital, get sick, and die. And we are seeing hospitalizations increase in the United Kingdom and the United States. And so one has to be careful in extrapolating that Omicron is mild across the board, although it certainly does seem that way, and we hope that that is the case. We also have to look at things like the vaccination coverage in older persons that hopefully that is higher. We have heard that in the 60s and 70-year-old age group that the vaccination coverage is indeed better. But we do know that people can die of Omicron who are older and who have significant comorbidities. Now, outside of that scenario alone, Omicron is disruptive to countries. If there is a surge in cases, like we are seeing here in the Bahamas, that means that people can be admitted for other medical problems that are not COVID admissions, like COVID pneumonia. They don't need oxygen, but we still find out that they have COVID. And that, if that is compromising the healthcare system, if wards are closed, if healthcare workers are out, and if the health system is compromised, that means essential care still can't happen. And so you see things like surgeries are being canceled, that non-COVID care is compromised, that there are persons waiting to get into non-COVID care, and that is also not acceptable. When we hear about changes in isolation guidelines and quarantine guidelines, this is to mitigate the interruption in essential services and other things that are happening because of this Omicron surge. And so surging numbers of Omicron cases are still a problem, not just to some elderly immunocompromised persons, but to people across the healthcare system and indeed across the country. Because of interruptions in services and people being out. But thank you for your question.
Thank you so much. Well, that brings us to the end of our press conference. I would like to thank my team, Dr. Indira Martin, Dr. Julian Bartlett, Dr. Moxie, Dr. Frank Bartlett, Dr. Forbes, and Minister Glenys Hanna Martin. And I'd also like to thank the press, as well as everyone here at the Office of the Prime Minister who has made this press conference successful. And we look forward for everyone to be with us when we do our second press conference, and thank once again the people of the Bahamas for watching and listening. And lastly, we wish you a Merry Christmas and a Happy New Year. And with that being said, please be safe, be careful, protect yourself, and when you are out there, make sure you wear your mask, sanitize, and execute all of the public health care protocols. Thank you, and good afternoon.